So if any of you have struggled with one or a combination of those symptoms, you may have a problem with your thyroid. Yes, there's a lot of other things can cause the same exact symptoms, but today we're going to focus on the thyroid side of things. So disclaimer before I get into this, everything and all of this that I'm talking about is to be used for educational purposes only and not to be used to diagnose or treat any disorders. So please, please, please talk to your primary care provider before making any changes to your healthcare plan. Good morning, Tesla. So the first step, if you're having any of these symptoms, is to go to your PCP and request a full thyroid panel. Now, you have to specify this because if you just say to your doctor, can you check my thyroid? I've done some research, I'm concerned. All they're going to do is run a TSH. So TSH is very sensitive to, it is the most sensitive test to diagnose and treat thyroid conditions. But if you only test the TSH, you're going to miss a lot of other thyroid conditions, and I'm going to go into that. So I told you guys to bring pen and paper. This is why, because we're going to nerd out today. So one of the biggest examples of a thyroid condition getting missed when the doctor only draws a TSH is subclinical hypothyroidism. And we're going to talk a little bit about that in a moment. So what does a full thyroid panel consist of? It's a TSH, a free T3, a free T4, a reverse T3, TPO antibodies, and thyroglobulin antibodies. With all of those, you can get a much more accurate depiction of what's really going on with your thyroid hormones, if it truly is your thyroid causing the symptoms, or if you guys need to investigate some other body system that may be causing this. Now, how does the gut tie into all of this? Good question. The gut is a main driver of all the thyroid hormones. So if there's something off with your thyroid, more often than not, there's also something off with your gut. Now, am I saying that gut health is contributing to all thyroid conditions? Absolutely not. But what I'm saying is, if you do have a thyroid condition or you have some of these symptoms, you most likely have something wrong with your gut as well. So they're definitely linked. So let's go back to the thyroid panel. There are a different combination of these markers that's going to tell you how to diagnose and treat whatever disorder that you're finding. Hypothyroidism is the most common thyroid condition in the United States. Hypothyroidism, think hypo means low. So the TSH marker works on a reverse axis. So when you have hypothyroidism, you have a slow thyroid, your TSH is going to be high. So slow thyroid equals a high TSH, and your T4 levels are going to be low. Now, hyperthyroidism, which is much less common, but it is still seen, is the complete opposite. So you've got a overactive thyroid, your TSH levels are going to be low, and your T4 levels are going to be high. Remember, they work on opposite axes. Both of these are treatable with medication. Now, here comes a little bit more tricky ones. Subclinical hypothyroidism, man, I can't talk today, which can often get missed because when you go for your yearly physical, a lot of times all they're doing is drawing a TSH, it could get missed. Subclinical, so which means your TSH levels, they may be normal or a little bit high, but your T4 levels can be absolutely normal. So what happens is if your doctor is strictly just looking at the lab work, but they're not listening to you saying, hey, like I'm cold all the time, my hair is falling out, I can't poop even if I take medications, or the only time I poop is when I take medications, I'm gaining weight, I've changed nothing in my diet, then your TSH levels are normal and your T4 levels are a little bit high. Treating the patient, subclinical hypothyroidism, that may be enough evidence to say, okay, maybe you do need medication. But again, this is all up to your PCP. So again, this is just educational purposes. Now, another term you're going to hear is sluggish thyroid. This is an unofficial thing. I have seen it so many times. It's not a true thyroid condition. It's not one that we usually treat with thyroid replacement medications, but it's when the labs are off. So you're going to hear this term from a lot of functional practitioners, and it just means that your thyroid may be a little bit slower than normal, but not necessarily slow enough to treat. So when this happens, you're usually going to have a normal T4 and normal TSH, or your TSH might be like upper end of normal when you're like right at the line of the normal ranges. It's hard to treat because it's technically still in normal ranges, but you may be symptomatic. That's where it gets really, really tricky. So you might hear that term. Another one is autoimmune thyroid disease. So hypo and hyperthyroid conditions can both be caused by autoimmune conditions where your body essentially attacks your own thyroid, where you develop antibodies that attack the thyroid, which is why in the thyroid panel, you're checking for specific thyroid-specific antibodies. Now, the different ones you're going to see is the TPO antibodies, which most family practitioners are aware of and test for, not quite as often the thyroglobulin antibodies. So these are responsive to treatment. Again, we'll talk about the gut health side of things in a little bit, but cleaning up your gut and balancing your gut health can absolutely play a role in the autoimmune side of thyroid disorders. So you got the thyroid panel, you got diagnosed with one of these conditions. Maybe you got diagnosed with a sluggish thyroid, which is an unofficial condition that they usually don't treat with medication. Now what? Step one, don't freak out. This is very common. And a lot of times the thyroid condition will resolve on its own, especially when you've got like a subclinical hypothyroidism. I've seen viruses like COVID viruses can mess up so much of your lab work. It can throw off so many different body symptoms. I'm still struggling with headaches, chronic headaches from COVID. Why? No idea. It's getting better though, so I'm just leaving it alone. The same thing can happen with your thyroid. So if you get one screening panel that's off, and maybe you're not like super crazy symptomatic, it is reasonable to wait 6 to 8 weeks, recheck it again. Now, if you are like hyperthyroid on your labs, you're having heart palpitations, you can't sleep, you can't eat, honey, you need to go on medications and you need to talk to your doctor about it. And if they brush it off, you need to remind them how symptomatic you are, because if it's affecting your quality of life and your labs are abnormal, that's when there's a means to treat it with thyroid medications. And obviously, whether it's hypo or hyperthyroid, that's your treatment's gonna depend on it. You can't treat hyperthyroidism with the same medications you're treating with hypothyroidism. So one of the downfalls of medication treatment, although it is very, very effective, it's overprescribed. About 30%, the data that I found, about 30% of people who are prescribed thyroid medications actually don't need to be prescribed it. Now, I don't know if that's data saying if you're diagnosed with subclinical hypothyroidism, don't treat it. And a lot of doctors will. They'll go ahead and treat because the patient is symptomatic. But 30%, that's a decent chunk of people taking medications that they perhaps don't need to be taking. So, like I said, it's not always super beneficial for people who have a sluggish thyroid. That's one of those conditions where you can really focus on the gut health side of things, and we'll talk about that in a minute, and then recheck in a couple of months, because a lot of times that will resolve itself and medications may not be necessary for the thyroid at all. Now, what are you going to do when you have these symptoms and your doctor tells you that you don't necessarily qualify for treatment? Number one, trust your gut, pun intended, because we're talking about gut health. Sorry, that's my nerd joke for the day. Give me a second. Let me take a sip. Good morning, Sarah. Thanks for joining. Hi, Mom. All right, we got quite a few people in here now. So if your symptoms are persisting, whether you're taking medications or not, if it's one of those things where you're like just watch and wait because they're not very off, they're at the higher or lower end of normal, and you're not seeing any improvement of your symptoms naturally without any changes, this is when you want to take a really hard look at your gut health. What are you eating? What are you ingesting? How is your lifestyle? Is your lifestyle reflecting that these symptoms should be improving or not? So again, the gut is the main driver of these hormones. So more often than not, if your thyroid hormones are even just a little bit off and you are starting to get symptomatic, let's take a big hard look at your gut. Fatigue, poor mood, constipation, hair loss, weight gain, sleep disturbances, poor sleep, whether you can't fall asleep, can't stay asleep, fatigue. How many people have fatigue? I feel like everyone has fatigue these days for a multitude of reasons. All of these can be caused by the gut and be mimicking a thyroid disorder, but truly it's your gut. So gut conditions are much, much more common than thyroid conditions. And the downfall of this is traditional Western medicine, when you talk about gut health, it's a buzzword for them and they don't really know what to do with it. Therefore, they brush it off. It's like anything else. Like when you really don't have a lot of information on that area, you just don't do anything about it. And that's not fair to you as the patient when there's truly something going wrong. You don't qualify for thyroid medication treatment, but you're just stuck living with all these symptoms that are like absolutely affecting your quality of life. So just as a healthy gut is linked to a healthy mind, we all know about the gut-brain axis. There's also a gut-thyroid axis. Same thing. There's a highway between your thyroid and your gut. So what are some things that you can try outside of medication treatments? The first one, which is a solid one to try first, is trying an anti-inflammatory diet. Now, I do touch on this in my gut health guide. So if any of you are interested, please put in the comments and say, I want a gut health guide, because I completed a couple weeks ago and I'm more than happy to give it to you. And the basis of the anti-inflammatory diet is to cut out all processed foods, because that's the biggest contributor to inflammation within the gut and the body. Now, it sounds easy. It's a little bit harder to live out, just like losing weight in general, eating healthier in general. Making any changes is hard. So before you start any changes, you really have to ask yourself, am I committed to these changes? Am I committed to starting this and sticking to it and seeing it through to see if it actually works or not? Because if you do something for 2 days and you don't see a change in your symptoms, you didn't really do it. Like, you have to give this at least 3 to 6 weeks, at least, as solid as you can, as adherent as you can. So anti-inflammatory diet is one of the big ones that you can try first. There is early evidence that shows changing your diet, like cutting out dairy, cutting out gluten, can lower thyroid antibodies. Now, am I saying gluten and dairy inherently are bad? No. Am I saying that every single person who eats gluten and eats dairy is inflamed? No. Some people don't have any issues digesting these things. Many people do. So going back to, don't be all or nothing. Don't leave this talk and say, oh, the main thing I took away from this today is that gluten and dairy are bad. No, that's not what I said. But if you're having some of these symptoms, you got your thyroid checked, you're not treated with medications, or you're being treated with medications and your symptoms aren't improving, an anti-inflammatory diet may be the way to go. And when you cut these things out, it's not a permanent thing either. There is a phase where you cut these things out to allow your gut to heal, to rebuild the appropriate balance of microorganisms, so that when you introduce it back into your diet, you can appropriately digest it without it causing inflammation within your body. It's all dependent on the person. So that's my thing with saying don't eat gluten and dairy, because I don't want everyone saying, oh, I shouldn't eat gluten, I shouldn't eat dairy, because that's not the case. For some people with autoimmune thyroid conditions, yes, you may have to permanently cut it out, or understand that when you eat gluten, when you ingest dairy, you might have symptoms. A lot of people will get joint pain, like achiness, if they'll get really stiff, achy joints after they ingest these things. And that's how they know that it causes inflammation in their body. So yeah, that's my take on that. Now, this is one that a lot of people don't think about. Your PCP is probably not going to mention this or offer this right off the bat. It would have to be something that you ask about. That's treating gut infections like H. pylori, or if you've previously traveled to foreign countries that don't have clean sources of water and you ate something that got contaminated. And if you remember like getting traveler's diarrhea or anything like that, you may still have lingering infections. You may have gut dysbiosis, where some of those, not necessarily bad bugs, but you may have like an excess of these bugs that could be causing these issues. So you would want to get thoroughly tested and treated for any sort of infections. especially like SIBO, H. pylori, any sort of parasite infections. A lot of people are walking around with parasitic infections. They have no idea. Um, it's scary almost. But if you're not having symptoms, it's not really causing a problem. It's no big deal. But if you have these symptoms and you don't have any treatment plan, it definitely will pay off to say, hey, maybe I should go down this avenue. Probiotics, we all know, we all hear how great probiotics are. They help in so many different areas of our lives. This is especially one of them. Now, of course, all probiotics are not created the same. There's so many brands out there. It's hard. It's just like everything else on the internet. What do I trust? Which strain do I buy? There's so many strains of probiotics. It's like, what do I get? How much do I need of each strain? These are all very, very valid questions. What I can say from my personal experience that I have used these supplements, I trust them and know that this is not a promo or anything like that, but I'm not going to promote something that I don't trust, is Dr. Ruscio's brand. It's from the functional medicine formulation. There's a triple probiotic plan that he uses where it contains the lacto-bifido blend, which is phenomenal. You've got your soil-based probiotic and you've got your Saccharomyces boulardii. And so when using all of these three together, they complement each other. So when you're when you want to start a probiotic, you don't necessarily need to go overboard and be like, hey, I need to buy all three probiotics. I need to cover everything. You can start simple. The most common one you're going to see on the market is the lactobacillus strands. That's a great strand to take when you're on antibiotics. So say you do get treated for some sort of gut infection. Say you go to the doctor, you get tested, your H. pylori breath test comes back positive, they treat you. You want to take a lactobacillus blend. That's a solid blend to take. That, and if you want to like complement and set yourself up for the best success, that and the Saccharomyces boulardii are two really good ones to take together after antibiotics. So I'm going to link the ones that I personally use below after I'm done with this chat, just so you guys can do your own research. At the end of the day, you have to do what you feel is right for you. You have to take this information, compare it to everything else you've experienced and everything else you personally know about yourself, and disseminate and say what's best for you. But I'm going to offer you and say, this is what I do, and it works pretty well for me. And then the last one is basic digestive supports. How are we doing on time? Okay, we still got plenty of time. I want to leave time for questions at the end. Basic digestive support. So a lot of people don't realize that between the food we eat being super, super processed and all the preservatives and all the chemicals and things that we eat, the world as we know it is changing. The air that we're breathing is changing. The water that we're drinking is changing. It has absolutely changed our intestinal health. So that being said, a lot of us don't have as many digestive enzymes as we need, as we used to have to break things down, like proteins, carbohydrates, fats. So that would be super beneficial to take. And there's a lot of supplements out there now where it's a probiotic and a digestive enzyme support. So some of the enzymes you can take is the stomach acid support, which personally I would say that would be one of your last things on your list to try, because stomach acid support is exactly as it sounds. So if you have too much stomach acid and you take a stomach acid support, you're probably going to give yourself an ulcer. So it can be dangerous. I would save that one for last. But a lot of people, more people than not, they don't realize you have reflux. You have like all these reflux, heartburn symptoms, and you think you have too much acid, but a lot of times we don't have enough. Especially with people who take chronic PPIs like omeprazole, Pepcid, Tums, things of that sort, which we all just pop some here and there and we think it's no big deal. But if you're going to the doctor all the time and they're prescribing you 8-week courses and you've done quite a few of those over time, more than likely than not, you have not enough stomach acid to break these things down. But anyways, that's a tangent. So you can buy these basic digestive enzyme supports. And again, all of this can help not only improve your thyroid condition or your thyroid symptoms long term, but all of these things used in addition to your thyroid treatment can actually complement the medication treatment, complement and help absorb the medications. Because think about it, if you're fixing your gut health and you're taking medications, well, where does medications get absorbed in? The intestinal lining. So if your intestinal lining is healthier and you have all the enzymes and you have all the bugs that you need, well, then it's going to make the medication even more effective. So this is a win-win situation, even if you're already on medications and you kind of want to accelerate the resolution of your symptoms. Now, going into, we talked about gut health and the medication absorption. What I wanted to say is if you're on medications for thyroid treatment, you start thyroid treatment and then you address the gut health side of things, you start taking supplements. What you need to make sure you do is follow up with your doctor. Make sure you're going back for the rechecks, because if you're starting to absorb this medication faster, what's going to happen to the drug levels? They're going to go up. So you might then go the opposite. So speaking specifically to hypothyroidism, because that's the most common one, you may start to notice hyperthyroid-like symptoms. So like jittery, restlessness, can't sleep, insomnia, racing heart, like I said previously, or like heart palpitations, feeling really hot all the time, starting to lose weight and having a decreased appetite and you don't understand why. All of these are symptoms of hyperthyroidism. So you would want to make an appointment. If you don't have one, go back, get your labs checked, because you may actually be going into hyperthyroidism and need to get your dose adjusted and dropped. So to recap, if you're experiencing any of these symptoms, fatigue, weight gain, hair loss, insomnia, constipation, or you're sleeping too much. Sleeping too much is more so the one for hypothyroidism. But if you're having insomnia, that's hyper. What's the other one? Dry skin, joint pain, muscle pain, in the absence of like starting a new gym routine or having any sort of injury. Talk to your provider. Ask for a full thyroid panel, being TSH, free T4, free T3, reverse T3, TPO antibodies, and thyroglobulin antibodies. It's a group of them, to check to make sure you don't have any sort of thyroid conditions. This is the bare minimum that they can use to diagnose something. And now, if any of this does come up positive, they may refer you to what is called an endocrinologist, which is a specialist for thyroid health, and they may be the ones to look over everything and treat you. So you have to be patient with this process. Again, even if your labs are abnormal and you do have a true thyroid condition, you can start addressing your gut health without your doctor prescribing the medications first. You can start working on these things. If your doctor tells you one thing and you're like, your gut instinct tells you that something is off, wrong, or you just don't trust them, it is okay to seek a second opinion. As your provider, we want you to be fully educated and fully confident in the treatment plan. And so if that means you going to another PCP, another specialist for a second opinion, by all means do it. It may take some time, but I would rather you be confident in the decision that you guys made in your treatment plan than taking this medication and being like, every day you take the medication, you're like, I don't know how I feel about this. Or every day that you don't get treated with medication because they said you didn't need it, and you're like, I think I might need it. Get that second opinion. It's okay. Insurances will usually cover a second opinion. You have a valid reason to seek it. And keep in mind, gut health. It plays a crucial role in general health, in reproductive health, in thyroid health, and mental health. It plays a role in all organ systems. So don't forget that it plays a role in your thyroid as well. And then again, just keep following up with your primary care provider if you do have a thyroid condition that you are being treated with medications. So I wanted to leave a little bit of time for you guys to ask questions. I'm going to scroll through real quick. I don't think there were any questions in the chat. I know this was some heavy stuff today. We talked about a lot of lab work and a lot of medical conditions. I want to be able to provide you guys with education so that you are confident when you're seeking out medical care. I don't see any questions. Sarah said that this has definitely helped me. Does anyone in here outside of Sarah, do any of you have thyroid conditions? I think there's not as many people watching anymore, but I would love to hear from you and what you've done, what you've been on for treatment, what helped, what didn't. Thyroid is is one of those things that doesn't get as much attention as it should because a lot of people are living with it and they don't realize it. So again, that's why I'm trying to bring new topics to talk about to bring awareness so that you guys are educated on how your body functions and how to manage your own healthcare plan. Thank you, Sarah. Just so you guys know, Sarah Cano, you'll see her in the comments. She was actually my nursing instructor way, way, way back in the day. I think back in 2009, 2010, when I got my associate's degree. So I've definitely come a long way. School was a struggle, but look at me now. With some time and some studying and putting in the work, here I am. So I love nerding out and talking about these things. So if you guys have specific topics that you want to talk on, say you've been diagnosed with some weird disorder that you haven't really read much about, I would love to be able to do research and present this topic to you guys so you can be more educated. So let me know if you're not comfortable putting it in the comments. You can always reach out to me directly in my DMs. I am going to be posting this on YouTube. So for anyone watching this on YouTube, feel free to reach out to me through YouTube. I'll make sure I post my email to reach out directly in the link. But otherwise, I hope you all have a wonderful day.